Good evening. Today we are going to do PSM. PSM has 25 questions in the Neetpg, and in the next also it has a lot of weightage as an individual subject. The PSM questions are quite common. They come from micro. They have an overlap with microbiology also. So if you prepare PSM well, you can solve some of the questions of microbiology also. If you prepare microbiology pharmacology well, you can solve PSM also. Some of the questions of medicine are also overlapping with this. So this PSM is a very important subject. We should concentrate on it, focus on it. So let us begin with the first multiple choice question. Savlon. Savlon contains A. Cetrimide plus chlorhexidine, B. Cetrimide plus chlorhexidine plus butyl alcohol, and the third option is cetrimide plus butyl alcohol, and option is cetrimide plus cetavlan. Cetrimide plus cetavlan. So what do you think the correct answer here is? It is cetrimide plus chlorhexidine. So Savlon contains chlorhexidine gluconate, that is hebetane, plus cetrimide in various percentages. In various percentages. Now coming to other antiseptics and disinfectants of importance are betadine. Betadine contains povidone. Then Dettol. Dettol contains chlorxylenol in 9% terpenol and 13% alcohol. The actin solution is diluted sodium hypochlorite solution buffered with boric acid. The actin solution is diluted sodium hypochlorite solution buffered with boric acid. Available fluorine is 0.5%. Then Usol. Usol is a solution of chlorinated lime 1.25% plus boric acid. Chlorinated lime 1.25% and boric acid 1.25% and 0.4% available chlorine. The Atkins solution and Isol dissolve pus and necrotic tissue in addition to being germicidal. So it is useful in cleaning the infected wound. So the correct option here is cetrimide plus chlorhexidine. Which of the following trace element has vitamin E like action? We all know the correct answer here is selenium. The correct answer here is selenium. So the correct option is A, selenium. Trace element has vitamin E like action. Cluster testing technique is useful in which of the following conditions? A, sexually transmitted disease, B, poliomyelitis, C, measles, and D, smallpox. Cluster testing. Have you heard of this terminology? What is cluster testing? Anybody in the chat box, please? Cluster testing. Here, the patients are asked to name other person of either sex who move in the same socio-sexual environment. These persons are then screened. That is known as cluster testing. Then contact tracing. Contact tracing is used the term used for the technique by which sexual partners of diagnosed patients are identified, located, investigated, and treated. So cluster technique is useful in which of the following conditions? Sexually transmitted diseases. So the correct option is A. Which of the following is false about intrauterine device? Multi-load copper 375 is a third generation intrauterine device. Copper devices are effective as postcoital contraceptives. LNG-20 Mirena has an effective life of 5 years. Pregnancy rate of Lipeslope and copper T200 are similar. So what do you think is false about intrauterine devices? First of all, copper devices are second generation devices. Multi-load CU375 is a newer copper intrauterine device. The copper devices are second generation, they are not third generation. So the first option is false. So the correct option here is A. Now coming to number of Anganwadis supervised by Mukhya Sevika is A 10, A 10, B 15, C 25, and D 30. Mukhya Sevika is a middle level supervisor. She supervises 20 to 25 Anganwadi workers. So the correct option here is C 25. Minimata disease is caused by toxicity of. This question has been repeatedly asked a number of times. It is a very old question. Minimata disease is caused by toxicity of, and can be asked again also. Mercury poisoning by toxicity of mercury. So correct option here is D, mercury. International Red Cross, we all know International Red Cross was founded by Henry Dunant. Henry Dunant. So correct option here is A, Henry Dunant. The Red Cross is a non-political international humanitarian organization founded by Swiss businessman Henry Dunant. Swajaladhara. Swajaladhara. This is very important. Swajaladhara is program associated with A. Provision of safe drinking water. Swajaldhara is a community-led participatory program which aims at provision of safe drinking water in rural areas with full ownership of the community. Swajaldhara has two components. Swajaldhara 1 for Gram Panchayat or a group of panchayats. Swajaldhara 2 for a district as such. So the correct option here is A. Provision of safe drinking water. Which of the following screening method is used under RNTCP? Under RNTCP, it is passive screening. So the correct option here is passive, B. Active case finding is not pursued. Case finding is passive in RNTCP. Dose of oseltamivir is in a child aged 9 months is oseltamivir in a child aged 9 months is C 3 milligram per kg twice daily, 3 milligram per kg twice daily for 5 days. So the correct option here is C. Rotavirus vaccine doses should not be initiated beyond this which age to prevent complications. So correct option here is C 12 weeks. Dukoral is we know it is oral cholera vaccine. Being's model of disease causation does not include A. Spiritual factor, C. Religious factors, C. Religious factors. Iodized salt in iodine deficiency control. This is primary prevention. A person has lost his leg in an accident because of which he is not able to walk. This is a disability. B. International disease surveillance is for A. Hepatitis B, polio, C. TB, D. Leprosy. Correct answer is B. Polio. Most important component of level of living is yes, it is A. Health. Attributable risk means risk difference between the exposed and non-exposed. The correct option here is C. Bergensonian bias is a type of selection bias. Problem of bias is maximum with cohort study. Randomization is done to reduce selection bias. Secondary attack rate is a measure of communicability. Transovarian transmission is seen in rickettsial disease. Post-exposure prophylaxis is indicated in all HBV. The amount of bleaching powder necessary to disinfect floral stores is 50 gram per liter.